Everybody, I'm Wydell Holmes. I'm with the City of Tempe Strategic Management and Diversity Office, and very glad to have our members of our Public Safety Advisory Task Force joining us again for some key updates. As we are on the Teams platform, just wanted to remind you that in the upper part of your screen, you'll see an icon for people. You can click on that to see everybody who is in this session. As well as to the right of that, you'll see a icon where you can join in on the chat. And then next to that, you'll see a hand and a smiley face. And when we do our open discussion, if you could utilize that, we'll try to get to as many comments, suggestions, questions as possible. As a reminder, we are recording the session this evening, and we will be posting that to our Community Safety Strategic Plan webpage for the rest of our community to share in the good works that you are doing here tonight. So with that, I'd like to turn it over to our Honorable Mayor Corey Woods.
Thank you, Wydell. Really appreciate it. I know we only have an hour tonight, so I'm going to be very brief. I just wanted to thank everyone for joining us this evening for this important update from our Community Safety Strategic Plan, and wanted to thank our staff. I know we have a lot of updates to give you in about an hour's time, so I know they're all going to make sure that they share any kind of feedback or progress that we've made over the last few months since our last meeting took place in, I believe it was late January. I think it was January 27th, actually, if my memory serves me correctly. But just really excited to have you hear about what we've got going on here at the City of Tempe, and just really appreciate you taking the time out of your Tuesday evening to join us. So with that said, I will turn it right back over.
Thank you, Mayor. Well, good afternoon and early evening to everyone. Rosa Chastity, Deputy City Manager, and we're so excited to be here with you to share the work. We rolled up our sleeves since our last meeting, and we're excited to share with all of you the work and the progress our city has been working on. Before we get started, I wanted to share, if we can turn to the next slide, some somber news, but one of the task force members, and I get choked up. It's Sue Bringler. If you all remember, a few months ago, I had mentioned that she had asked to be removed from the task force because she had been diagnosed with cancer that was early in the year. Unfortunately, she emailed in June, she had texted me actually, and said that she was cancer-free and that she had now working on recovery. And unfortunately, things took a turn for the worse. So she recently passed away. The mayor and Councilmember Kuby and I attended her service on Saturday. It was a beautiful service, but I wanted to share this with you because I think we all come together as task force members to do important work for the city, and we grow relationships. And I've known Sue since my kids were in kindergarten, Our Lady of Mount Carmel. She's always been a role model to many, many people in this community, but I think especially to women because of her ministry for women and looking to create inroads for women in ministry. So Sue loved tie-dye, as you can see in the background. She also loved to have quotes on her Facebook. And one of the last conversations I had with Sue was about the courageous space that we all entered to do this work. And she had emailed June 14th specifically and said that she had been watching the task force updates on Channel 11, and that she wanted to make sure the interfaith network and faith community stayed connected with the work that you all are doing. She thought she was so proud of our community in Tempe. And I thought this quote was appropriate for all of you. The purpose of life is not to be happy. It is to be useful, to be honorable, to be compassionate, to have it makes some difference that you have lived and lived well. And from her to you, I would say that we weren't always happy on these calls, and we come back together to talk about the good work, the hard work, but we are making a difference in our community. So I just wanted to share that with all of you, and we'll get started on the updates. So a quick agenda overview. As Wydell mentioned, we have a few slides to share, especially everyone from the task force who's been working in their respective areas. We have come together monthly as a team, but also there have been daily work and conversations on this. So we would honor the work of our staff, and they're going to present their pieces to all of you. So as you can see, it's been a 1-year anniversary, if you can believe that. And I just shared with Wydell, lucky for us, it's 1 platform tonight, not 3. And we're not exactly out of COVID, but we're close. So it's nice to have 1 platform and share a more intimate setting with all of you. Eventually, we'll get to see each other in person. As you will recall, Community Safety Strategic Plan had 6 pillars. We will give you an update on those 6 pillars. We will ask for the discussion towards the end once everyone has had a chance to present their piece, and then we'll talk about some of the next steps. So just to take a step back, as you know, our Honorable Mayor Woods brought us together on October 13th, 2020. It's hard to believe it's been a year. It concluded, we did have our last meeting in January, but we came back together in June just to make sure we ratified or at least came to some agreement on the recommendations. The recommendations included 5 pillars for those of you who are joining us for the first time as staff, and 18 strategic directions. The cadence of communication has been identified that we wanted to make sure we brought this to you, and that's why we're here today. But we also have already identified a cadence of communication with all of you, and we've identified April 2022 to come back to you. Next slide. So oversight and implementation, I speak to you, but this has been the work of a lot of people who have been invited on this call. Everyone from our city manager who's on, Andrew Chang, the chief and our police department, but also human services and our attorney's office and our fire department and a lot of other departments, as you can see listed here, that are very vital to this work. As we know, as community in creating community safety, it's not just the responsibility of one person or one department, that it is really a comprehensive look at our entire city. Next slide. And with that, exactly as I just said, there's an intersectionality of this work. And I think it was Raquel Gutierrez who, through a few sessions, kept saying there are a lot of initiatives that the city has. How do we make sure that they're codified or that they're coming together to advance the higher calling of creating a very safe community? And we keep that in mind every time we meet. We understand that there's strategies to every initiative or program that helps advance the work. I share with you this diagram because it helps exemplify all the work that the city is doing, from the right to breathe, equity and action. I saw Keisha on the call, Community Reinvestment Roundtable, which is really initiated by our community partners, not a program led by the government, but it's really led by the outside looking in on advising us on budget and other strategic initiatives. The chief also created a chief's advisory group that helps create a continuous feedback loop for what is occurring in the police department that involves the community. The chief's employee group, our employees are vital to understanding the higher vision of transformation and changes and new adoptions. So that he has created a chief's employee group. And then obviously the Public Safety Advisory Task Force is an important part of that intersectionality. And then what I want to share with you next is a 911 cohort, which I think Jacob spoke to it at various meetings. Next slide. So I have invited Amy Pedato to join us because she had approached our city. She is a Tempe resident. She also is an employee of GCI, Grand Canyon Institute, and others about helping us advance this important work. So if you can all recall, we were applying for hopefully a grant or somehow to get the Bloomberg organization to help us with advancing it, looking at reimagining what 911. In essence, having the right person on the right call, which is a huge lift. We were not selected for that cohort, but better yet, Tempe has created a cohort here, grassroots, from our community that involves, as you can see on the left, from Grand Canyon Institute, who has assembled partners from Northern Arizona University and Arizona State University, the Academy for Justice. And we have started that work. And on the right, you see the outcomes that we hope to see, which is really reducing the reliance on traditional law enforcement and 911 responses. So reimagining who goes on the calls. This has been a huge lift and just coming together, and we will be looking at data, looking at the calls for service, and really looking at it from all sides as far as how do we reimagine and deploy a new service. So I wanted to share that with all of you because that will be a huge lift, but we've started with the right people on the committee. Next slide. And with this, I'm going to turn it over to Assistant Chief Andre Anderson. And you all have not met Andre. He was hired soon after we met, and he would like to kick it off with sharing the first pillar, the police and model and accountability, and what they have been working on. I'll turn it over to you, Chief.
Thank you, Deputy City Manager in Charleston. Good afternoon. My name is Andre Anderson, as you've heard, and I've served as an Assistant Chief of the Field Operations Division of the Police Department. I want to talk to you real briefly about the Police Chief Glover's vision to embrace a community engagement, community policing, and to redirect resources while rethinking policing with a focus on what we call the 3 C's. Now, these 3 C's represent 1, community policing. They represent what's important to the department, community engagement, as well as collaborative leadership. Now, each of these principles intertwine are designed to shape the organization. In fact, what they do is they help us to adopt a shared yet common community goals that comport with your recommendations. To add to that, we've included a staff study. Now, this staff study is being finalized to create a roadmap. This roadmap is for the continual evolution of organizational effectiveness. It's going to right-size our police department by forging and allowing us to create better partnerships through community policing. Our staff study will expand non-badge, unarmed civilian resources. It'll also take a critical look at how we'll be utilizing these non-badge, unarmed civilian employees to handle calls for service traditionally responded by uniformed sworn police officers. And that is a change with respect to reimagining. Now, our intended results that we see will be to focus on our efforts to build relationships. We want to do that by increasing positive contacts in the community. We want to further embrace the tenements of community-oriented policing. It is our goal to reduce response times to emergency crimes in progress while increasing and enhancing specialized training. That training such as the areas of mental health and de-escalation techniques. These are critical areas for us in this day and time. And this will allow for us to increase employee mental and physical wellness training, as well as allowing us to be more aware of what transpires day to day with not only the police officers, but the people we come into contact with. This is a phased-in approach, and our part is about 5 years, which we will put in place this plan soon. As such, what I want you to know is that we're going to be placing an emphasis through the police chief to ensure we have balance, compassion, an approach that requires our officers to always safeguard the community members' concerns with every police contact we have. With that, I'll turn it back over to Wydell.
Thank you, Andre. I'd like to invite Judy Bauman, our city attorney, regarding the Family and Victims Bill of Rights, please.
Sure. Thank you, Wydell. Good afternoon, everyone. Judy Bauman, city attorney. So we had been asked in part to look at utilizing data and transparency to create a Victims Bill of Rights. One of the things that we looked at, in addition to what the Arizona Constitution provides, is focusing on an amendment at a local level that would better protect victims. We ended up researching various locales. We looked at 8 local communities. They're listed there for you, just to see what other folks have done. Some of these communities have not necessarily enacted a Bill of Rights, but yet provided various guidance. We are currently reviewing what California has done. The state of California actually enacted an amendment to their constitution that provides additional protections for victims. As late as last month, October, there has been some briefing filed by various stakeholders, ACLU and Department of Justice, among others, that have made some, we think, fairly good arguments that express their concern about the impact that this may have on those that are accused of crime. So we continue to review data. We will continue to look at briefing and other information provided by various stakeholders and hope to improve at the local level, and we will return with additional information. Thank you.
Thank you, Judy. I'd like to invite Sergeant Rob Ferraro, and he will be followed by Deputy Director of Human Services, Paul Bentley.
Thank you, and good afternoon, Mr. Mayor and members of the Public Safety Task Force. My name is Rob Ferraro. I'm a sergeant with the department. I've been assisting with behavioral health call diversion solutions prior to law enforcement interaction. We began the process by taking inventory of current internal assets such as Human Services, Care 7, and our HOPE team. We then broadened our assessment to our region's community behavioral health system, which includes the nearly $1 billion public health contract, which also provides for a robust array of crisis services in Maricopa County. Our goal is to leverage all available resources and to remain member-focused, utilizing the appropriate resources when needed. The traditional model of just send the police was reevaluated because in most behavioral health instances, that's not the appropriate level of care. Our immediate goal is utilizing Solari to divert 911 calls for individuals experiencing a mental health crisis or suicide ideation that meet a certain criterion, specifically those where the person does not have the means or access to lethal weapons. The key objective is to help stabilize the individual experiencing a mental health crisis in the community over the phone without the need for a police response. Data indicates that of the nearly 18,000 calls Solari's handles monthly, nearly 90% of those calls are stabilized over the phone, not needing a police or mobile crisis response. For those calls we have diverted to Solari who are not able to be stabilized over the phone, Solari will then dispatch the most appropriate in-person response. We will soon begin training our communications bureau to better determining which calls are appropriate for diversion. We are fortunate to have multiple blueprints to guide us, with the city of Phoenix, Mesa, and soon Chandler all taking this innovative approach to call diversion. In speaking with departments from across the country, even those considered to be innovative and progressive, we did not find any that have access to the rich array of community-based resources that we have access to, which is required to even consider this model. Call diversion will begin by end of Q4, and hopefully by Q1 or latest Q2 of 2022, full integration of Care 7 in terms of first response to Tempe community members and back-end support in terms of follow-up for Tempe community members will be in place, meaning Care 7 mobile crisis will be dispatched first by Solari, which is the Community Behavioral Health Crisis Call Center. This has never been done before, and we will be the first agency and city to accomplish this. In leveraging all of our internal and external partners, we will provide for clear lines of communication and proactive contacts by appropriate professionals in an attempt to prevent the future crisis to ever occur. We will continue to strive for 100% crisis intervention team trained officers in patrol. Currently, we sit near 60%, which is 3 times the national average recommended by the Department of Justice guidance. Tempe PD also enjoys the highest percentage of crisis intervention team trained officers in the Valley. We look forward to reporting out our successes at the next meeting. Thank you very much.
Thank you, Sergeant Ferraro, and I'd like to welcome Deputy Director Paul Bentley of Human Services. As we pause here, Shireen, I'd like to ask, you have your hand up, so I'd like to respond to that. You have a question or a comment, please?
That was in error.
Oh. Okay, well, thank you. So we will we'll go ahead. I wonder if Paul is having some technical difficulties. We'll go ahead and we will come back to Paul's presentation regarding
I'm
power.
back.
There you go.
Wydell, I'm back, if that's okay.
There you go. Thank you, Paul.
Yeah, the technical difficulty was clicking the button on the microphone, so I apologize. So So, all right, I did it. Chalk it
No
up.
worries,
So
we've all
good,
been there.
good afternoon. I'm Paul Bentley, Deputy Human Services Director, and I appreciate the opportunity to speak on the Human and Social Services pillar this afternoon. One of the specific action items that we're presenting on tonight was the recommendation to expand and increase funding for CARE 7. And so while this chart has a lot of information on it, the presentation here is to communicate that an interdepartmental work group was created and placed emphasis on promoting the health and welfare and safety in our public spaces this late last year, early this year. And from that, a specific 6 strategy recommendation was brought forward for mayor and council that focused on enhancing our homeless outreach efforts within the community, creating a mental health response through CARE 7, providing unarmed support for security within our parks, communicating to our community the work that's being done to promote the health and safety, as well as to engage our community with responses and input to help influence and to guide our actions. In that, what this slide is specifically intended to present is that from that work, a supplemental request was submitted for mayor and council to review, which included, again, the CARE 7 crisis, mental health crisis response initiative. The total request for the supplemental was approximately $1.7 million. And through mayor and council support, $1.3 million through this competitive process was funded. And so in that, with specificity for expanding and increasing CARE 7 funding, this supplemental does include the newly created and implementation of a mental health response team that is coinciding with what Sergeant Ferraro just spoke about with our 911 alternative response systems. In addition to expanding funding for CARE 7, there was a recommendation to implement and create a family advocacy center. This was also supported by the Family Justice Commission and their desires to have the similar type of services made available within our community. Briefly, a family advocacy center is a one-stop location for those who have been in trauma as a victim of crime to receive services, whether it being a victim of sexual assault, domestic violence, aggravated assault, or other forms of crimes, child crimes as well. Again, a collaborative effort was put together from staff, which included members of the Tempe Police Department, Human Services Department, Arizona State University, and their police department representation, and also getting guidance and subject matter expertise from Honor Health as a medical provider. From that effort and mayor council support, funding was allocated to implement and create a family advocacy center in the city of Tempe this fiscal year, with a current budget over a 5-year window. Services provided in this location will include forensic examinations, space for victim interviews, advocacy and victim rights, counseling, family support services, food and clothing, and then trauma healing programs and services. This model is based off of national best practices, and we are excited about the implementation of this facility this year. As far as staffing, this location, once we finalize the lease agreement, will include members of CARE 7, the Victim Advocacy Program, which includes the supervisor, advocates, a trauma therapist, a trauma healer, and also Sully, our trauma healing dog. Tempe Police Department will be including staffing as well through their Victim Services Unit with their sergeant and 6 detectives, and ASU will be on site as well with detectives and advocates as well. So we're really excited to inform the task force this evening that this initiative is moving forward, it's funded, and we're currently going through lease agreement negotiations with a property owner at this moment.
Thank you, Paul. We do have one hand up, Keisha.
So the Family Advocacy Center was brought in large part by, student activists who were pushing for a rape crisis center. And I know ASU then went and asked y'all to make this, and y'all collaborated on this Family Advocacy Center. But when we asked for a rape crisis center, we specifically asked for it not to be that the police not be the ones to handle rape. Because the police, when women get raped, they don't want to have to deal with police, which is not safe for them. And I'm seeing here now that, and I understand some of this isn't y'all's fault, but the fact that we asked for a rape crisis center and we asked specifically for it not to have police, and then you guys hire 9 cops in between Tempe and ASU is really concerning to us.
Keisha, if I can respond to that, and I appreciate your statement, and our intention is to ensure that this is a human services and social services prominent facility with what's being provided. And so first, to clarify, the staffing that's listed on this document is current staffing. No new staff has been hired or been asked for through a budget process. And so these units are currently viable and available within our community. They're just in different locations, and the intention is to bring them into one location. As well as the facility itself, the way we are structuring it with its space planning is that the area in which victims arrive and receive services, it is an area that is their location to promote their healing. And so there's very limited interaction directly with law enforcement. It is done only when it's necessary as far as the interview process. Again, in order to provide that opportunity for our victims, instead of them having to drive throughout multiple locations in the city, it would be in one location. But your points are absolutely well taken, and the intention of how this facility is being structured and the way we're providing services is that the initial interactions that are being provided with those who have been victimized are those from someone who is a victim advocate, a civilian within Care 7, or a trauma healer or a counselor. And so again, it's social services based, and social services facing to help support those who are victimized in the healing process, and having only those touch points with law enforcement when it's absolutely necessary as part of the investigative process.
So I just wanted to point out that you said it's human services focused, and you have 8 human services and 9 police officers. So I would just invite you to reconsider that, and that if this is about healing, then I would want to see more trauma healers and more therapists to really be able to hold victims, and less police officers, because like we were talking about earlier about shifting resources and services to people who are more well off to deal with that. When someone comes to a family advocacy center, 9 cops versus 8 social workers is not social worker first. So I'll just leave it at that.
Thank you for your comments, and I appreciate them. The other point that was asked for us to report on this afternoon is the recommendation to explore the Coots and Whitebird Clinic model of completely independent entities. And so within this particular recommendation, Tempe Human Services has completed a comprehensive review of the Coots model and compared it to current practices within Care 7 and HOPE and the Tempe Fire Medical Rescue. Research included meeting with representatives of Coots from Eugene, Oregon, and we're happy to say that one of those representatives is actually a past intern within Care 7. While many communities around the nation are considering options for reimagining public safety, the Human Services Department already has a crisis response initiative in Care 7 that utilizes a trauma-informed approach to crisis response. Care 7 has operated for over 20 years and offers 6 distinct programs and services centered around supporting mental health to improve lives and strengthen our community. Care 7 services are available to all community members, including City of Tempe departments and their employees. Coots reports that many of their interactions involve people experiencing homelessness. And while Care 7 responds to calls and serves this population, Tempe Human Services also has a dedicated homeless outreach team to which referrals are made. Homeless outreach is conducted by the City of Tempe's HOPE team, and the team currently consists of 8 homeless outreach specialists, and they assist both singles and families experiencing homelessness with the goal of obtaining emergency shelter and/or permanent housing. So this chart that is shown on the slide compares the core services provided through the Coots model with Care 7 and Hope Service Delivery. Combining Human Services response with the Tempe Fire Medical Rescue Patient Advocacy Services, or PAS, the City of Tempe service model provides a more tailored response to the needs of the Tempe community.
Thank you, Paul. I'd like to invite our Chief Information Officer, Mark Wittenberg, followed by Assistant Chief Andre Anderson.
Great, thank you, Wydell. Appreciate the intro. Mark Wittenberg, IT Director, here to talk to you today about the data and transparency pillar. I like to describe this as a phased approach, and what we're looking at doing is if you can kind of think of this as you're building a house. And so the first phase of this, or phase one, our request for proposal, is to understand like what components do we want to put into this house. And then the second phase of that, which is the budget and build, is like, let's build the house. So with that in mind, there's several components to the first piece, the request for proposal, which is actually out on the street right now. And we've had a lot of interest from vendors. It's actually, we've had the most questions about this one RFP than we've ever had for any RFP that the city has put out on the street. But the first piece of it is to really get an assessment of where are we today? And that's going to be done by interviewing, and we'd like to interview not only the Public Safety Advisory Task Force and you all, but then the various departments that are contributing to this. As you're hearing about the different plans, you hear data a lot, and so we really need to understand what data is needed to inform these kinds of decisions. And then we need to understand, it's like, where are the gaps? How do we collect that? Are there policies that need to be changed? And then we'd like the vendor to come up and recommend what the architecture, or this is the building diagrams of the house we'd like to build. The second piece of that is going to be then the build piece, which is, let's build this, I call it a scalable data platform, because we don't want it to just be for public safety. We'd like this same platform to be able to be used across the city for other reasons. And then close those data policy gaps and then publish that data. So one of the things we've been working on, next slide, thank you, is what data do we have? And so we're pretty proud of the fact we've been working on this hate crime dashboard within the city for actually a couple months. And so we want to publish what we have out there and keep these things moving while we're figuring out how to build this house. So this dashboard is actually up and available right now at our open.tempe.gov. And it's really to understand what is a hate crime and educate the community so that we can reduce harm. So for example, it's like, how do we define bias? Examples of hate crime, national comparisons, so that we can really frame our data. And then of course the Tempe specific data, which is where these hate crimes and bias crimes have occurred, and then the specifics about what they are. So again, we're trying to work on the data and information that we have to be able to frame a story and then bring that to you all. The next dashboard we're working on is a PD staff demographics to ensure that we're really representing the community and the demographics of the community.
Thank you, Mark, and I'll re-invite Assistant Chief Anderson.
Thank you, Wydell. We're here to talk about community engagement, and as we see it here in the police department, we know that both community engagement is the relative of community policing, and yet we know that they both work in tandem. Hence, it is our goal to develop a new concept by consolidating parks and crime prevention under one roof called the Police Chief's Office of Community Policing. Now, this unit will be jointly led by an unbadged, unarmed supervisor. This supervisor will work collaboratively with the Department of Human Services and other wraparound services to ensure that we provide the best resources we can to community members. The team will align internal as well as external problem-solving methods. Those methods will be designed to create tailored responses. Tailored responses will allow for us to emphasize on the quality of life decisions based on not just one rigid set of rules, but the totality of the situation as we address people in need. We believe that this process in bringing resources together constructively will address our community engagement needs. It will foster our neighborhood policing, and it will allow for us to build relationships that both build trust and legitimacy. Thank you.
Thank you, Assistant Chief. And as we have only a few more slides left, I'd like to invite our communications and media relations representatives, our manager, Nikki Ripley, and our PIO, Chris Baxter.
Thanks. Good evening, task force members. I'm Nikki Ripley. The bottom line of my couple of minutes with you tonight is to let you know that we have established a series of web pages and that we would like your opinions about them. So the web pages live at tempe.gov/community safety, and they're live now, and you're welcome to go through them and get back to us with your feedback. The objective for us in creating these pages was to really create a hub for information and background and tracking and status updates about the community safety effort. So I'll just kind of hit a few highlights. You'll see several different types of resources there. The dashboard that Wydell's about to talk about that tracks the strategic plan progress. We delve into and link out to the initiatives that relate to this one. And we have a detailed timeline about the larger environment, various events of the past, present, and future we intend to reflect here on the timeline. So as I said, your input is more than welcome. You can express it to really any city staff member and it'll get back to us. But primarily if you send it to myself or Wydell or Rosa, we will definitely take a look at your input.
Thank you, Nikki. And to just follow up on some of the content in regards to the community safety webpage is we have on the left-hand side a navigation to the actual progress of our community safety strategic plan. And this plan was inspired by the 5 pillars of recommendations from the task force. We have added a sixth pillar in regards to environmental design for safety. And so this is a live web page or platform actually, where our staff and the owners and project managers of all of the recommendations being implemented and even strategies that are still being developed can report on their progress. Wanted to also share with you that the website has been dropped into the chat so that you can explore and feel free to provide your comments and feedback. We want to make sure that our community knows what's happening, but mainly we want to share also that the intention of gathering the task force was not just to have a series of conversation, but to move those recommendations into action. And this is another way to communicate to our community as well as to you in regards to what we've done, what we're still pending, and then what status is regarding the recommendations. One element, an example here is that you can see on the left-hand side, we have the initiative police model and accountability. One of the strategic directions is restructuring public safety and roles and calls for service. And then you'll see your 3 strategic directions listed here. You may also find more. When you click on each strategic direction, you'll be able to see the status as well as some of the specific activities that are in place to achieve this recommendation and achieve the outcomes that the task force discussed. I will also be sending out the slides of today's presentation, as well as we'll drop into chat some of the other dashboards that we've discussed this evening. I think there's a request right now for the hate crimes dashboard, so I will get that dropped into chat before the end of this meeting. With that, I would like to invite Mike Pooley, our assistant, I'm sorry, I almost promoted him to city manager, my apologies, our assistant police chief, Mike Pooley, in regards to our pillar of culture, employee wellness, and our culture.
Thanks, Wydell. Appreciate that. As we talk about our workforce culture and wellness, this is something extremely important to us. One of the steps we have taken is to develop a process and policy of the Officer Craig Tiger Act, which has been fully implemented in our department now. This policy streamlines the way in which our officers can get assistance after being exposed to a traumatic event. Just to refresh your memory, the Craig Tiger Act is legislation that was designed to provide police officer services for those that have been exposed to traumatic events in the course of their duties. It is also to ensure our officers can return to work in their normal lives and to address and treat mental health issues before they develop into PTSD or other conditions. Another step that we've taken in supporting mental health and wellness is to create and develop a wellness coordinator position, which will be a new position in the police department. We currently have a temporary position for that right now. The wellness coordinator is going to oversee all police wellness programs to include the Craig Tiger Act. This new position will work to educate and provide resources for all employees, both sworn and non-sworn. Some of our non-sworn employees often get forgotten, and those are which include our dispatchers, which oftentimes are exposed to traumatic events as they're occurring over the phone or the radio. Our forensic service techs who respond to scenes of terrible crimes and have to process the scenes and be exposed to it as they do that and take photographs of the scene as well as the victims. Some of our other positions are other non-sworn personnel in the field that are also exposed to the same traumatic events as our officers, and it's important for us that we take care of every employee of the police department. This wellness coordinator is going to oversee our peer support team, which is made up of members of the department throughout different areas of the department. It's also this person will oversee the critical incident stress management response team, as well as manage and help with education prevention and to provide resources for mental health, family health, and financial health and physical health for all our employees. Some of the next steps we're looking at is duplicating something similar to what the Craig Tiger Act is for all non-sworn personnel. We know that completing all of this is a high priority for the police department, and we want to make sure we are providing a workforce that is mentally and physically healthy to respond to calls for service with compassion and professionalism for the city of Tempe. And can we go to the next slide? And as we continue on for workforce culture and wellness, over the past few years, we've worked really hard to develop a new de-escalation training as a smart policing initiative through the Bureau of Justice Assistance Program. We're proud of this, and we know that one of our accomplishments is this new de-escalation training. And one of the things that we're happy to say is that we have fully implemented this training to every police officer here in the city of Tempe this year, which we just recently completed. We also are going to continue to give this training, this new de-escalation training, to all new police officers that will come into the department every time they do. We'll also continue to develop and update the training over time. At the very beginning of this project, an ASU research team was dedicated to study this training to see if there was any positive results from it. A research project had never been done like this before. So just a real quick brief on this training. ASU researchers found positive results of this training. During their research phase of this training, there were two groups, one group that had been fully trained and a controlled group that had not. The researchers from ASU reviewed thousands of hours of body-worn camera. They conducted citizen surveys of those that had been contacted by our officers that had been trained, and also the controlled group who had not been trained. They found that the trained officers were significantly less likely to use a condescending or patronizing tone, more likely to attempt to build rapport, use time on their side, use less force, and prioritize de-escalation. All of our policies have been modified to include this de-escalation training and what's taught in the de-escalation training. We also know that there are several things we can do together as a department and our community to better our officers and the department and the community. So something that the community is proud of and that trusts. And I appreciate you letting me be here to speak with you.
Thank you, Assistant Chief, and I will turn it over to Rosa and Chelsea for our final presentations.
Final slide, everyone. So as Wydell mentioned, we added a sixth pillar. And one of the things that we have heard from community, and we know historically, how do we prevent crime, or how do we prevent the feeling of unsafe in a community? And we know that crime prevention through environmental design is a real thing that we hear from our neighbors, as far as natural surveillance through lighting and landscaping readjustments and things like that. So We have been in conversations with our community development department about expanding that role. And it's something that happens through community development in partnership with the police department. But definitely this is something of an opportunity through architecture. We also have someone on the Human Relations Commission who has offered her services, and this is what she specializes in. So that is the last slide, everyone. So we were hoping to open it up for discussion. The next steps for us would be have some discussion today, but know that we would create that cadence of communication. April 2022 is when we would come back. And I think there was one question during the sessions that we had last year about what updates would be provided for mayor and council. We have been providing that through the Human Services Working Group. And then we are providing this information in a packet also to the mayor and council. So with that, we'll open up the floor. I have never seen this group so quiet. Did something happen? Technology? Something crashed?
I think we're still good.
There have been some comments in the chat.
Yes.
Yes, thank you.
If I could say just one thing, that was the voice of our wonderful intern, Ben Williams from Arizona State University, who has just been fabulous in helping us set up the platform for tracking our project plans, as well as sharing, the status reports on implementation. So thank you, Ben. There is a question in the chat in regards to the possibility of attending the de-escalation training for those who would choose to from the task force.
Yeah, I could speak to that real quick. Absolutely. I would encourage that anybody that would like to come out and review any of the training that we do, especially the de-escalation training, just to get a firsthand view of that, to definitely look to coordinate with us to make sure that you get the dates. We do have some training, I believe, that's going to be coming up in December. That's going to cover some of our de-escalation program. And so love to have you guys out.
Thank you, Chief. Genevieve Vega has her hand up.
Yeah, thank you. The first thing I want to do is invite, I guess, Jacob to expand on his comment a little bit more. There was a lot of discussion around community policing, and I just don't know if he's still on the line to talk a little bit more about that. And then I have a question. I'm not still seeing him in here. Okay, so with because I'm interested in the community policing aspect, I'd really like to understand more about that, and maybe I just need to reread or re-review some of the content that we have. My question outside of that topic on community policing is, so first, great job. Thank you so much for the update. There's a lot that it sounds like you've implemented in the last 6 months or so. So I'm really interested when it comes to behavior changes. So it's one thing to introduce new policies, new programs, new activities, and then it's another thing to kind of reinforce that, provide the enablement to behave in a new way. It sounds like a lot of cultural change, a lot of mindset change, and that's not easy and that's not quick. So, I'm just curious as to what thought or intention has been given to the long-term behavioral changes that y'all are looking to make, and whether or not you're experiencing any resistance right now. That was a loaded and very difficult question. So if a bunch of you need to respond, or
I think the chief is going to jump in.
Okay.
Yeah, I'll jump in briefly. I mean, there's, with change, change is always difficult. So you're always going to have difficulty in making sweeping change. That's why it's always best to try and do that incrementally. Part of the initiatives that we have in place, everything that we're doing here with the recommendations from the Public Safety Task Force, that's why this is being done in stages. It's allowing for people to adapt to the change that's going on around them. And it's actually giving them a little bit of, of empowerment. When I created the employee advisory group, it's to discuss some of the changes that are occurring in the organization and allowing for the employee work group to provide feedback as well. That gives them an avenue of being able to have discussion about, the different topics as we are starting to evolve. It gives them that opportunity to provide that feedback and to also be a part of the change in culture. Then they go out and they are able to advocate then to the rest of the employee workforce some of those things the initiatives that are taking place. So that's just a small aspect of what we're trying to do and what we're trying to accomplish is that over time, as we are engaging back into the community policing philosophies, and I know that you're saying that you need to read up a little bit more on what we're doing, but it's about relationship building, whether it's badged or unbadged. This is about being able to have good communication and contact with our community through our police department, because we will have police officers and we're going to have those that are not police officers working in the police department. But we all have to coexist and we all have to work together and we all have to build those relationships with our community, and our community has to be able to work with us. So overall, that's how we are taking those small steps to make sure that we're headed in the right direction. And anybody else wants to jump in.
Well, I was just going to mention, Genevieve, we take everything, the resources that all of you have provided in conversations. You provided a great survey regarding change management, and the chief and I and Wydell and other chiefs met to discuss a strategic planning session that we're going to have in January. But setting the table with a pre-survey, right, to understand questions. And I always say when you ask people for their opinion, whether it's a survey or in a conversation, you're inviting them and it's a statement of you're important to me. And what is happening right now as change occurs, we need you with us in this change. So we're excited about that. That is going to be a huge lift in January. The chiefs already have identified folks, various levels of the organization to have that strategic planning. But please know that tool that you've texted me or you forwarded to me, it's already being utilized, and Wydell's laughing. So be careful, all of you. Anything that you share with us, we actually do something about it. So thanks for asking that question, Genevieve.
Right.
Any other comments or questions, need for clarification? How about the cadence of reporting back in April? Any questions regarding that? I know we keep in contact, many of you, with all of us here in various ways, and you send great articles, we read them, we process. I am shocked how quiet it is. I don't know what to do. I appreciate it. Well, unless anyone else has any comments, it is 5:27. Any closing comments, Mayor? I'll turn it over to you.
Well, no, thank you, Rosa. Really appreciate all, your hard work, and Wydell, and obviously the members of our Tempe Police Department, Chief Glover, Assistant Chief Pooley, and Sergeant Ferraro, and obviously our Deputy Human Services Director, Paul Bentley, and everyone else, for all the task force members for attending, Mark Wittenberg as well, our CIO, and obviously Assistant Chief Anderson too. Really appreciate all of the hard work here. I know there's been quite a few recommendations that were made. I think you said 18 over the course of the 7 previous task force meetings, and so I know that our team has been hard at work between the Tempe Police Department and Tempe Human Services Division, as well as just city management and our Chief Information Officer, on trying to put this all together and synthesize this into a comprehensive kind of set of recommendations and implementation work that people can very easily understand. One of the things I was very excited to see in my kind of preview of this meeting a day or so ago was that front-facing dashboard. I really think it's really exciting that people will be able to, at any point in time, go to the dashboard and frankly take a look and see exactly where we are on all of the task force recommendations. And that will allow you to track things in real time. But of course, if there are questions or concerns about any of them, you'll have the ability to reach back out and ask those. So I think that's a really great thing when it comes to transparency. Let me do here, just because I see Jacob is back on the line. I see he asked the question about I know Genevieve had sort of prompted about wanting to have Jacob Rayford address his comments in the chat about community policing. So since I see he's rejoined the call, I wanted to sort of turn over my I'll cede my time and let him ask his question or offer some comment. So Jacob, you're on the call.
Yeah, I'm not sure if y'all can hear me, but I just wanted to address the importance of looking for alternative measures to policing. You know, when police entities are speaking on utilizing the community as methods of policing or is a means to police, it takes away the whole point of looking for alternative to policing solutions. You know, that's what a lot of us advocates are doing, is looking for legitimate ways to you know, look at different means other than, you know, authoritative approaches and whatnot. So, you know, the whole reason why we agreed to join these, you know, conversations is because there is an issue when it comes to police brutality and things of that nature. And when you have other people taking up that mantle on behalf of those those entities, it could create further issues in the future. So I'm not sure if we have enough time to really address that, or, you know, we can hopefully have other conversations before April, but that's something I'd like to personally look into directly.
Thank you, Jacob. Absolutely. And just for an example in my head, and we can have another conversation. Jacob's great about continuing to have updates with us as staff. The Solari model, that's one example of what you're saying that isn't police driven, right? Or it's not community. It's kind of looking at innovative ways, like the 911 cohort that we're creating for looking at different folks to go respond to the calls that we do have in our community for needs. Is that correct? I don't know if you heard me, Jacob.
I'm sorry, it was bad connection here. I'm not not in my house at the time.
It's okay. It's okay. We can talk offline.
Absolutely.
Thanks, Jacob. I appreciate it. And then I think there's one more comment in the chat. Okay, and Chief addressed it. Thank you. Okay. Thank you, Chief.
Yeah, I was going to say, Rosa, to Pam's comment in the chat that I just saw as well. You know, given that, you know, Chief Glover's volunteered to address, you know, further questions about community policing or anything else we discussed tonight, I'll definitely, you know, obviously he is far more the expert than I when it comes to addressing those matters, so I'll let him do that. But clearly, if there's further conversations people would like to have with me as well, I mean, obviously, I think everyone on the call has my cell phone and email, and I'm more than happy to continue those discussions.
And yes, thank you, Mayor. I think that is a great idea. And sorry, I think we have a community reinvestment roundtable meeting this coming week regarding strategic planning and budget. So we can talk about some of the things that you put in the chat regarding reallocations. Any other questions? If not, it is 5:32. Okay. Well, I appreciate seeing everyone. Stay healthy. And you know how to get a hold of us. We want to make sure we're accessible. Appreciate your time, your insight, and your dedication to our community. So have a good evening. Thank you.
Thank you. Have a good night.